And now, members, I want to talk about the misplaced priorities that this bill represents. SB5 is merely the latest attack in what can only be characterized as a war on women's health in the state. Steps taken by the legislature during the 82nd regular session helped pave the way for these most recent attempts to limit access to family planning and reproductive health services. An article in the Austin Chronicle from April 22nd, 2011 lays out the dramatic actions taken by the legislature to defund Planned Parenthood, which results, of course, in an increase of unplanned birth and more women who will confront the difficulties that are presented by virtue of SB5. I want to read from that article. It was titled "The War on Women's Health." To attack Planned Parenthood, lawmakers undermine health care and promote more abortions. It was written on April 22nd, 2011 by Jordan Smith. On April 1st, following several hours of intense floor debate in the Texas House on the string of budget amendments seeking to reallocate funds designated to provide basic women's health care services, the dust was settling. Conservative Republicans claimed victory. 7 amendments had successfully stripped from the roughly $99 million pot almost $62 million intended to fulfill the state's commitment to provide family planning and reproductive health services for thousands of low-income, uninsured women. Meanwhile, another successful amendment enacted a funding matrix designating to which health care providers and in what order the remaining funds would be allocated, a move designed specifically to yank public funds from Planned Parenthood. Foes of reproductive choice with the statewide group Texas Right to Life were quick to post to the group's website a self-congratulatory statement, taking credit for dismantling the state's family planning program. Quote, "Texas Right to Life removes $61 million tax funds from abortion industry," proclaimed the headline. Indeed, says TRL's Elizabeth Graham, her organization helped lawmakers orchestrate a strategy to strip the family planning program of as much of its federal funding as is legally allowable. Spearheading that effort means that members of the legislature had come to Texas Right to Life asking about family planning revenue and how to take money away from abortion, she said during a recent interview, and to redirect the funds to more deserving and more worthy programs. With a $27 billion state budget deficit for existing services, there's no shortage of underfunded programs, and some of the programs to which the family planning funds were diverted are certainly worthy. One amendment moved funds to mental health care for children, for example, while another diverted funds to services for children with multiple disabilities. Yet conservative opponents of family planning, including TRL and the amendment sponsors, refuse to acknowledge that none of the federal money that the state has traditionally used to fund women's reproductive health care is used to fund abortion services. Federal law expressly prohibits using the funds for that purpose. Instead, the funds used for family planning provide low-income women with guaranteed access to very basic health services, including annual gynecological exams, counseling on pregnancy planning and access to birth control, screening for breast and cervical cancers, testing for hypertension and tuberculosis, and screening for sexually transmitted infections, including HIV. Taken together, these preventive services make up what is commonly referred to as a well woman check. For hundreds of thousands of Texas women, the services provided with these funds represent their only regular and reliable access to medical care. Not surprising, therefore, advocates for women's health care viewed the debate somberly. Devastating, said Fran Haggerty, CEO of the Women's Health and Family Planning Association of Texas, a group that represents a diverse mix of 58 family planning providers across Texas. There will be very quick consequences for the state, she says, including increased costs for unplanned pregnancies, costlier cancer treatments begun in later stages of disease, and ironically, a likely increase in the number of abortions. The facts about what the federal money actually pays for and the long-term risks and costs of failing to fund these preventive health services have not prevented anti-abortion lawmakers and advocates from alleging that the opposite is true. Some simply ignore the facts. TRL insists that family planning funds are merely blood money, while others draw a direct line from family planning funding to abortion via their favorite target, Planned Parenthood. In fact, the vast majority of the 90-year-old nonprofit services are dedicated to preventive health care, and less than 5% of its Texas operations, not supported by government funds, involve legally protected abortion services. That remains too much for these staunch defenders of life. For years, Texas lawmakers have declared that they would love nothing more than to defund Planned Parenthood entirely, regardless of the effect that it would have on the larger women's health care network. And this year, with a GOP supermajority at the Capitol, the rhetoric has been ratcheted up. The assault on family planning funding in Texas is just one symptom of this singular focus nationwide. In Washington, D.C., GOP lawmakers recently tried and failed to ram through a budget amendment authored by Indiana Representative Mike Pence to ban Planned Parenthood from getting any federal funding for any purpose whatsoever. They're not about to quit the fight. Concurrently, conservative lawmakers propose cutting all funding for teen pregnancy prevention programs and for Title X, the 41-year-old source of revenue dedicated to women's reproductive health services, and the one pot of money that Texas lawmakers are powerless to divert to other programs. They're going after women's health, said Cecile Richards, president of the Planned Parenthood Federation of America, during a February press call. This is the most extreme assault on women in decades. They want to eliminate vital health care for more than 5 million American women served by Planned Parenthood, including 3 million women its clinics serve nationwide using Title X funds. The Texas Senate has yet to debate its somewhat less draconian budget draft, but whatever the differences between the chambers that remain to be hashed out before final passage, it is clear that thousands of low-income and uninsured women will have little or no access to health care for at least the next 2 years. Amid all the supposedly high-minded and abstract debate about where life begins, one overwhelming reality is all too easily ignored. What is misleadingly described as defunding the abortion industry is in fact the wholesale shredding of the healthcare safety net for women in Texas and the U.S. In Texas, attacks on funding for women's health care are nothing new, and the specific attacks on Planned Parenthood are as old as the organization itself. No question. Planned Parenthood has been around for 90 years. From day one, we've had a handful of folks who didn't think birth control should be legal, says Sarah Wheat, Vice President of Communications for Planned Parenthood of the Texas Capital Region. Those attacks have come from foes of birth control, of equal treatment for women, from those opposed to non-procreative sex of any kind, and simply from opponents of abortion. We believe that women's health is important and that women and families are healthier when pregnancies are planned and spaced, Wheat says. Healthcare should be just as accessible and affordable for low-income women as it is for the rest. Planned Parenthood takes that commitment seriously, and over time it has come to be the nation's leading provider of reproductive health care for women. At one time or another, 20% of women nationwide have used Planned Parenthood services. Currently, the organization operates more than 800 clinics across the country, performs 1 million Pap tests, and more than 800,000 breast exams each year. both critical to the early detection of cancer, and provides nearly 4 million tests and treatments for sexually transmitted infections. These preventive services, combined with dispensing birth control to more than 2.5 million women annually, help each year to prevent more than 600,000 unplanned pregnancies, according to Planned Parenthood statistics. According to the federal government, $1 invested in family planning services saves taxpayers nearly $4 in other health care costs. In 2010 alone, more than 260,000 Texas women, men, and teens were served by the state's 81 Planned Parenthood clinics. More than 120,000 were screened for cervical and breast cancers, and more than 380,000 received testing and treatment for STIs. In 2010, more than a quarter of Planned Parenthood's Texas patients were low-income women served by the state's pass-through of federal funding, including from the state's pot of Title X funds. Planned Parenthood is not the only provider of health care for low-income Texas women. Each year, some 78 contractors across Texas, funding roughly 286 providers, receive federal funds allocated by the state to provide this basic care. In fiscal year 2010, these providers used roughly $47.6 million in funds to provide basic health care to a total of 257,895 low-income clients. Of these groups, the public providers saw the most clients at just more than 86,000, 37% of all low-income reproductive health clients served with these funds. But at $219, these groups' cost per client was higher than that of Planned Parenthood. The other contractors include city and county health departments, hospitals, community health centers like Austin People's Community Clinic, standalone family planning clinics, and federally qualified health centers. However, Planned Parenthood's long institutional history has allowed the organization to hone its delivery of preventive reproductive health care to women across the country and in Texas, making it uniquely able to provide services in a cost-effective manner in even the most isolated communities. Last year, Planned Parenthood clinics in Texas used federal funds to see more than 73,000 patients at an average cost of just $168 per client. These economic realities haven't prevented lawmakers from trying to find a way to defund Planned Parenthood. Before this session, the last major attack came in the 2005 legislative session in a budget rider authorized by Senator Robert Deuel. Deuel walks an interesting line on women's health care. He's a doctor, and neither the benefits of preventive care nor the unique needs of women are lost on him. Deuel is openly hostile toward Planned Parenthood, though his explicit reasoning is supposedly magnanimous. Planned Parenthood services are limited and occupy a niche, he argues, and the state should focus its limited health care dollars on first funding more comprehensive medical providers, namely federally qualified health centers. These FQHCs aim to serve any and all indigent clients in need of a medical home, serving as a portal for care for a variety of health services, such as mental health and dental care, in addition to reproductive health. Lawmakers approved the Deuel rider, directing the Department of State Health Services to direct $10 million each year from the state's family planning money first to fund FQHCs before allocating the remaining money to the rest of the state's providers, including Planned Parenthood clinics. This would seem to make sense. Providing low-income patients a single point of entry for medical care is not a bad thing. In practice, however, it hasn't helped to expand access to care. For starters, there are fewer than 70 FQHCs across the state, and because they aim to address so many different health issues for a needy population, many of them are already bursting with patients. The rider took effect beginning with the 2006 funding cycle, and the consequences were immediate. That year alone, more than 41,000 fewer women were provided with reproductive health care funded by 3 main pots of federal money: Title V, the Maternal and Child Health Block Grant, Title 20, the Social Services Block Grant, and Title 10. Together, the three provide services for women not eligible for Medicaid. In the following year, more than 28,000 women lost services, according to Haggerty of the Women's Health and Family Planning Association of Texas, who regularly compiles statistics and crunches numbers provided by DSHS and the Health and Human Service Commission that pertain to women's health care. The FQHCs simply could not absorb the clients who were hemorrhaged from the more traditional family planning providers that lost funding because of the FQHC allocation. And the FQHCs that have received funding have not been able to spend all of it, each year returning a significant amount of money to the state for reallocation. And though the 26 FQHCs that are now receiving funding for these services have steadily increased the amount of money they're using, their average cost per client is $225. So they're still not picking up nearly as many clients as have lost care since the imposition of the dual funding scheme. In 2010, FQHCs saw just 13% of clients for reproductive health funded by family planning dollars, according to DSHS. And of course, this is part of why so many are concerned about Senate Bill 5. With fewer dollars being directed particularly toward reproductive health care, the need for those services, abortion services, has risen, and with that need, of course, the consequences of Senate Bill 5 becoming even greater. I return to reading the article.